Hi, Adam Stern here again at KCRS23. I'm here with Dr. Vincent Xu from Dana-Farber Cancer Institute and Harvard Medical School. Dr. Xu is an expert and an investigator in biomarkers. So if you don't mind telling us a little bit about why biomarkers are important and which ones specifically you're investigating that may have potential in kidney cancer.
Great, happy to do it. Thank you, Adam. And when we think about treatment of kidney cancer, one thing that really distinguishes kidney cancer from a lot of other cancer types is that we don't have an easy blood test that tells someone, how much cancer do I have? Do I have cancer? Is my cancer getting better or worse? For example, patients with prostate cancer have a PSA, and that number goes up and down and really tracks with cancer status. That's something that we're really missing in kidney cancer. If we had that, it would let us know a lot faster if treatment is working or not, and it would give us some sense if someone has recurrence without having to wait for a scan.
So this could someday lead to a blood test, for example, that would tell you how you're doing without necessarily having to get CT or MRI scanning.
That's exactly right. And the hope is not that this will replace CTs or MRIs. Scans are going to continue to be really important. But as you might imagine, it's a lot easier to get a blood test, which often happens anyways every time we go see an oncologist, whereas scans are usually done only every few months. So sometimes if the disease is growing quickly, this might let us know about that sooner compared to waiting for a scan.
And the sooner you know about something, presumably, the sooner you can act on it in some way, even if that action is active surveillance.
Correct. And so this is important for patients in potentially a lot of situations. For someone who, for example, has a strong family history or genetic mutation that predisposes to having kidney cancer, this might be a surveillance tool that lets patients know when they may be at risk, and maybe can replace a lot of surveillance scans for people who don't already have cancer. People who do have cancer, the hope is that this can help indicate if a treatment is working early on, so you don't have to wait for the full 3 months to get your first scan before you have a sense.
Now here at KCRS, I know you were speaking about KIM-1 in particular. Is there anything special about this particular potential biomarker that has drawn your interest?
KIM-1 is interesting for a few reasons. One is that KIM-1 is really elevated in kidney cancer, and it's in two different types of kidney cancer, interestingly, both in clear cell and in papillary kidney cancer. The other thing that's really interesting about KIM-1 is that it's actually very easy to measure. There are lots of different biomarkers that are being presented today and that were presented yesterday at the Biomarker Symposium. Some of these biomarkers are very sensitive, but extremely expensive and labor intensive. For example, biomarkers that involve a lot of computation, looking at DNA methylation patterns. These require a whole laboratory and computational setup, as well as lots of blood. The distinguishing feature with KIM-1 is that it can be measured in a very tiny amount of blood, and the test to do KIM-1 is a relatively cheap and easy test that can be done actually in most laboratories.
All right, thank you very much. We really appreciate your time.
Thanks for that.